Hello, I'm Tylah Tully, and today I'm joined by Professor Michael Fahey, who is a paediatric neurologist and clinical geneticist. He is head of the Paediatric Neurology Unit at Monash Medical Centre and Director of Neurogenetics. Professor Fahey was the first to prescribe Neurotech International's NTI 164 drug to treat ASD and children with neurological disorders, and has since become an advocate for the drug during its clinical program. Professor Fahey, thanks for being here today.
Thanks, Tyler. Very nice to be here.
So, as we said in the intro, you have extensive experience in paediatric neurology, especially working with children with complex neurodevelopmental disorders like ASD and Rett syndrome. Can you tell us more about these disorders and how they impact patients?
Yeah, sure. So these are lifelong neurodevelopmental conditions that frequently present in childhood. There's no cure for them currently. With things like ASD, we're looking for ways to modulate the symptoms that people have. And while neurodiversity is highly acceptable, people are often troubled by symptoms, particularly things like outbursts, emotional dysregulation, or problems with socialization and anxiety. Rett syndrome is a condition which affects young women. It's a childhood onset condition where people have a degeneration in what they can do. They lose skills over time, and they're frequently troubled by again anxiety, troubles with interacting with people, and they can be quite distressing for individuals and their families.
So, what drew you to work with Neurotech and NTI 164 as part of its clinical program?
It's a really good question. There's not many treatments available for these conditions. For ASD, firstly, there's a lot of treatments on the market. A lot of them are not enabling, so a lot of them cause people worrisome side effects. They make people gain weight, they make people tired, and they interrupt what they can do with their daily life. And so we're in desperate need of a sort of treatment which doesn't have those side effects for a start, but also can enable people to interact and act better with their surroundings, with their environment, with their family. For Rett syndrome, there's currently no treatment. It's a condition which has a continuous course, and people are very distressed by this. And so, as a paediatric neurologist, I'm always after the opportunity to work in a situation where we can benefit people, benefit their families, and look for novel treatments.
I think you've just touched on it there, but what are the limitations of current therapies? And can you speak to NTI 164's efficacy and talk us through what you've observed so far?
So for ASD particularly, because there are no current therapies that change the disease in Rett syndrome. So for ASD, current therapies are often using medications like antipsychotic medicines to calm people down, using anti-anxiety medicines like the SSRI groups of drugs, or using medicines like some of the heart medicines that can make people feel less anxious. They all come with side effects. They all come with the possibility of weight gain. They all interact with other medicines. And we're looking for new things which can help people with ASD live a better life. So for the NTI 164 product, in our preliminary trial, we saw really promising results from that. People were able to socialise better, people were less anxious, people communicated better. And I suppose that one of the really heartening things that we saw in that trial was that people were able to tell us they did something they'd never done before.
He's getting back out there and building his confidence. And that's, for us, the most important thing.
Families would tell us that they went out to dinner as a family for the first time. Children were able to attend school and sit in their regular classroom rather than have to be educated on their own. And so those sort of things are more telling, I suppose, than any number that a doctor might give. The stories really mattered to us. When we came near the end of that trial, the majority of people said, look, we don't want to stop. And again, that told us a lot about what the medicine was doing and the benefits that it was showing, because they wanted to extend out.
So what excites you most about the potential of NTI 164, both professionally and personally as a clinician working with these families every day?
So what excites me is really the opportunity to provide something new, provide something that people have been asking for, which is a medicine that enables people to be their best, that Oftentimes we hear words from families like it changed who they were or they became a zombie. That's not been our experience with NTI 164. People have been more alert, more able to participate rather than less able to participate. And I'm always interested in something which might provide a different avenue for therapies, because paediatric neurology and paediatric neurodevelopmental conditions are really a field where it moves slowly, I think it's fair to say. And this is a chance for us to do something which might revolutionise our treatments.
And finally, if you could share one key message about the NTI 164 program, what would that be?
I think it's a really promising program. I think we're early on in our days of proving that it works, but everything so far has been very, very encouraging with well over 9 out of 10 people who have continued on the medicine saying that they felt that it benefited them. And I think that's really promising.
Professor Fahey, thank you so much for your time today.
Pleasure, Tom.
For more ASX news and analysis, subscribe below.